It is Sunday, April 6th. On my way into work, schedule changed a little bit this week, so I get to work this Sunday for a little bit, some peace and quiet for a few hours at least this morning. So I wanted to talk a little bit about antidepressants, my history and experience with antidepressants. I know that can be a somewhat controversial subject. I'm not a doctor, so I can't give you medical advice, but I am a person who's struggled with depression for 20 or 30 years. And for a large portion of that time, at least half, I've been on antidepressants. I've been on 3 or 4 different antidepressants at different doses. And so I want to share I'm not a doctor, but I think I can share my experiences with you and tell you a little bit about some of the research that I've done. You've done some research online and I'll share my thoughts with you. I would encourage you to do your own research. I think, to be honest with you, a lot of the impacts and effects of antidepressants have not been well studied. So it's hard to figure out what the truth is. And the body's complex. Understanding the effectiveness and impact of any kind of medication is a challenge, but especially medicine's attempt to fix what's wrong with the human brain, which is the most complex thing in the universe. And then probably the next most complex thing is the human body. So we're trying to rewire 2 of the most complex systems in the universe. And that's hard. But I'll share with you my experiences. The short takeaway is I think if you have severe depression, severe long-term depression, you should seriously consider trade-offs that come with being on an antidepressant. And you should probably take an antidepressant. If you don't have severe depression and you think you can manage your depression with diet and exercise, get enough sunlight, some therapy or counseling, I think that's probably a better route than medication. So that's the short version, but those are my conclusions as a non-medical professional, as a patient. Well, let me tell you how I got to those conclusions, give you a little bit of my backstory. Before I dive into my history, just with medication in general and with antidepressants specifically, I'm going to just put my cards on the table here so you know what my biases are. I think that's important. When I was growing up, I think I, like a lot of Americans, just put a huge amount of faith in doctors and the medical profession. Basically thought doctors were saints and that you should do anything that they told you. And now that I'm a little bit older and I'm also a licensed professional like a doctor, I am a little more cynical. I've realized I've also had some more experience than I want with institutionalized medicine, we'll call it that, which has helped me be a little more of a realist. But I realize that doctors and other professionals like psychiatrists are like land surveyors. They're fallible. They make mistakes. There's good doctors and bad doctors, just like there's good surveyors and bad surveyors. I think most people that become doctors have good motives and they want to help people. I don't think most doctors are doctors just because they want to make a lot of money. Although in America, that's a reason to be a doctor. I think most doctors want to help people. I think they suffer from the same problems that surveyors suffer from. We're arrogant. We deal with hubris and overconfidence. And we take shortcuts and we rely too much on our own judgment. So doctors, I think, suffer from a lot of the same problems. And I've seen that in my experiences with institutionalized medicine. So I'm way more skeptical now than I used to be of the medical advice that I get. I also think, and this is probably something that sets me apart from a lot of Americans, is I study economics and economic incentives. I'm a self-taught hobby economist, and I understand that doctors operate in a system of institutions with really bad incentives. Basically, the way we pay for and operate health insurance in the United States creates some really bad incentives. The fee-for-service model tends to lead to overtreatment. Pharmaceutical companies and pharmacy benefit managers and health insurance companies and hospital chains influence policy and legislation to their financial benefit. So you have to understand that's a very complicated and highly rigged system. I will let you know, I am not anti-modern medicine. So I don't consider myself to be a fanatic or an extremist. I'm probably a little more willing than your average American to try alternative therapies. I did physical therapy, had a knee injury, did physical therapy. I was super skeptical at first. And I'm a huge believer in physical therapy now. I do think diet and exercise are really important. Like I had a hernia. I had a hernia a few years ago, a couple years, 2, 3 years ago. Yeah, I went in and saw a doctor, got a surgery, took opioid painkillers. So I do believe there's a role for institutional medicine. I wish the institutions were different. I don't think we're going to be able to accomplish a lot there in this old world that we live in, but there is, I'm not going to die because I won't have a surgery. I'm skeptical of institutionalized modern medicine, but I'm not a fanatic. And I do believe it has a role. I think you've got to be a really educated consumer and be skeptical. So I just put my cards on the table there. And I do think we overtreat. So we tend to overtreat in America. We tend to give people pills and put them on the surgery table because making lifestyle changes is hard. And I don't think that's good for us. I think the medical profession would be better off giving us some tough medicine and telling us what we didn't want to hear. I am happy to tell you that my wife and I have a really great primary care physician. And he does talk to us about diet and exercise, which I appreciate. He told my wife and I on our last visit, because my wife and I are trying to eat a little better and exercise. And he said, every American was doing what you and your wife were doing, we wouldn't need doctors. So I think he's a good doc and he understands that lifestyle changes can make a difference. The last thing I want to say before I dive into my own history and personal story is your body and your mind and your life are unique. And when I say unique, I'm unique in the true sense of the word. Sometimes we say unique in English when we mean special. I don't mean special, unique. There's nobody else with your mind, body, and like literally no one else. And people react differently to medications. And I think we're starting, even mainstream medicine is starting to recognize that now more than it used to, that different people react differently to medications. I think there's a broader recognition of that. So you can't just take what you're going to learn from me and apply it to your own body or mind or life necessarily. I hope it makes you think about some stuff and I hope it makes you ask some questions, but you got to do your research and maybe experiment a little bit and see what works for you. I tell people the same thing on my business podcast. I'm like, you can't just take my advice from my business and just go directly to apply it to your business. Your business is unique and it's very different from other survey companies. So you got to be careful with this trying to translate stuff because sometimes things don't translate well. All right. With all those disclaimers out of the way, and by the way, I don't have a lawyer. I really think it's important to understand my biases. This is a controversial subject and people get emotional about it. And I feel strongly on either side. And so I thought it was really important for you to understand where I was coming from. All right, so let me tell you a little bit about my history with medication in general. And then I'm going to talk specifically about my history with antidepressants. So I have not typically been a person that likes to take medication. I am relatively healthy. I've always been pretty healthy. I was a little scrawny as a teenager, and in my early 20s, I was probably a little underweight, but I've always been very healthy and very physically active. But I would say I'm much healthier probably than your average 45-year-old American male. So 6'1", 6 foot, somewhere in there. I weigh 180 pounds. I could probably lose about 4 or 5 pounds. But in the last 2 or 3 years, I've dropped about 60 pounds of fat. I exercise 3 to 4 days a week, 2 hours at a pop, pretty rigorous exercise. When I'm in the field for my job, I'm very active. I burn a lot of calories. My wife and I eat pretty good. We don't eat a lot of boxed or frozen food or processed food. She's a good cook. We like to eat healthy. Again, we're not fanatical. Every once in a while, we have twice a month, I have a pint of Ben & Jerry's ice cream, people. But we eat pretty good. We eat lean meat, vegetables. I'm on a keto diet. I have a little bit of fruit, but I'm primarily on a low carb diet because that helps me keep the weight down. Look, I'm pretty healthy. Yeah, way more healthy than your average 45-year-old man in America, I think. Yeah, I don't know. I'm in the top 25%. I can probably comfortably say that. So I don't need a lot of medication, and I don't take a lot of medication. In fact, we'll talk about this in a few minutes, but the only medication I basically take is my antidepressant. Now, and this time here, I'm happen to be recording this in April. Middle of March to middle of May, I take an over-the-counter allergy pill because we have really bad air quality here in Central Valley. I'm highly allergic to the almond trees or the grass or whatever it is that blooms this time of year. But that's it. That's all the medication I take. Now, I don't like to take painkillers. I suffer from some pretty chronic pain. It's pain to my wrists, just from overuse of the keyboard, primarily in my wrists. And I don't take Advil or Tylenol or ibuprofen for that. I just power through the pain, try to manage it. I manage it with my knee pain. I manage with stretches, and the pain in my wrists and elbows, I try and manage with massage therapy, which makes a big difference, and some acupressure. But I don't take pain meds. I probably could. I just power through the pain. And the reason I bring that up is I think that is related to the mountain man ethos I was raised with and this ability to just be tough and fight through the pain. It's also a little bit hard. You got to be careful what kind of painkillers you take when you're on an antidepressant, because your antidepressant thins your blood. At some point, the painkillers thin your blood even more. So you got to be a little bit careful with that. So I don't take painkillers. When I had my wisdom teeth out, they gave me Vicodin, made me sick to my stomach. Like I was dizzy. I couldn't walk. I wanted to throw up. So I didn't take it. I think I took it 2 days, and then I switched over to ibuprofen. That was when I was in my early 20s. Basically had no other kind of history with medication other than my antidepressant until I got hernia surgery. So a couple years ago, I got hernia surgery. It was a horrible experience. The surgery itself wasn't bad. The recovery was pretty tough, with a lot of pain, way more pain than I thought for just 2 or 3 stitches. And some of that was related to the actual incisions and the repair work on the hernia. And some of it was just related to the internal gas I had coming through my shoulders, which is excruciatingly painful. So for that surgery, they gave me oxycodone. Super weird experience for me. Really loved that drug. I am not going to lie. Took away all my pain, gave me a warm glow. Like, really like that drug. Never had a painkiller like that before. Like, that is my painkiller of choice for sure from now on. Liked it so much, it scared me a little bit. In fact, after about 4 or 5 days, when the worst of the pain was over, I gave the bottle to my wife. And I basically said, do not let me take these in the daytime anymore. I can only take them at night to sleep. And then after about another week of doing that, I told her, flush these down the toilet. Really liked oxycodone. For the first time in my life, I could understand why America had an opioid epidemic and a massive problem with opioid addiction. Yeah, that was a really good drug, and it made me feel really good. So it's scary. But other than when I got my wisdom teeth out and when I had my hernia repaired, I basically haven't been on meds. So I don't ever take meds other than my antidepressant and my allergy medicine for that couple of months in the spring. Okay, so let me tell you a little bit about my history with antidepressants. I'm 45. I've probably been on antidepressants for 10 or 15 years. I've been on at least 3, maybe 4. You have to try some different kinds. I started, I think, on Prozac. Then I went to Zoloft, and now I'm on Paxil. I think there was another one in the mix there, but I can't remember. If there was, I don't remember the name. I'm sorry. So I've tried all 3 of those drugs, all pretty low doses. I think I was on 10 milligrams. I can't remember how much Prozac I was taking. I was on 10 milligrams of Zoloft, and I'm on 25 milligrams of Paxil. Take it every day, once a day. I take it in the morning. Each medication had slightly different side effects, but they're similar enough that I can't really tell you the differences because I don't remember. But I'll talk in a minute here about the general side effects of all of those medicines. As far as I know, they're all the same class of antidepressant. I think they're called SRI, serotonin receptor inhibitor or something. They basically change the way your body reacts to the neurotransmitter called serotonin. Serotonin is just a type of chemical that you have in your brain that impacts the way brain signals work. I do not fully understand the medication or how it works. I don't even know that the medical profession understands exactly how it works, but it does change the way signals are transmitted in your brain. One of the things I learned this morning was that serotonin also influences other processes in your body, like your immune system and your digestive system, which I did not know until this morning. That makes some sense to me because I noticed that when I'm on antidepressants, it's harder to keep off my weight. So it makes sense that it might have some relation to your immune system. So anyways, I've tried several. They are all very similar. Do like Paxil the best. So I think the drugs have gotten better. I have noticed less side effects as I've switched to the newer versions of the antidepressant. I think I'm on pretty low dose. So got to keep that in mind. If you're on a higher dose, the medicine will probably work better. It will probably also have more severe side effects. I'm on a low dose, I think, because I manage my depression. I try and manage my depression through diet and exercise and get lots of sunlight and through trying to meet my spiritual and emotional needs, manage the way I think, manage my negative thoughts. So those are all coping skills. I'll talk here on me. I'll talk here at the end, the very end. I'll talk a little bit about my struggle to stay on the antidepressant and why I think I could probably get off. I'll say that for. Okay, so let's talk about the side effects that I have. Pretty common side effects with all of these medications for me. So I mentioned one is weight gain. I don't know how it's hard for me to disentangle how much of my weight was from the antidepressants, but over that 10-year period, the first 10 years I was on antidepressants, I put on about 60 pounds. I managed to get that weight off the last 2 years, but it took major lifestyle changes. So I exercise a ton and I have to be very careful about what I eat. I'm pretty disciplined about what I eat. So I don't eat a lot of calories and I eat pretty lean. So low carb and vegetables with a little bit of fruit, almost no carbs unless it's my cheat day. So I think weight gain was a challenge for me and I've been able to deal with that challenge, but it takes a lot of effort. Not everybody's going to want to do that for sure. One of the complications, one of the reasons why any kind of medicine is complicated is antidepressants, I think, made me gain weight. One of the problems with being a man and gaining that weight is having that extra weight drops your testosterone production. One of the other things I learned is like testosterone for a lot of different reasons is really important for men. But as much as we are cursed by it and wish we could get rid of it, that's also a vital part of how men's bodies regulate themselves. And if you take an antidepressant because you don't want to be depressed, you gain weight, that weight gain suppresses your testosterone. One of the consequences of that could be depression. So it's complicated. But I have been able to get the weight off and do a pretty good job keeping it off. I know from experience from my hernia surgery that if I stop my rigorous exercise program, I pretty quickly put the weight back on. So my hernia surgery, I couldn't go to the gym for about 2 months and I probably put on 15 pounds, 10 to 15 pounds. So it came back pretty quick. Suspects that probably has something to do with medication. All right. A couple other side effects for me. Makes me sweat. I sweat a lot. I sweat more than normal people. Not a huge deal, but yeah, I sweat. It seems that Paxil is better than the other drugs on that particular side effect. So I think sweat more than a normal person. But I used to clean t-shirts and I would change into a dry t-shirt at about 2:00 in the afternoon. I don't have to do that anymore. So I think Paxil's a little better about that, but I perspire a little more. That's basically it for me. There's one more thing that I'm saving to the last, but as far as like day-to-day side effects, the weight gain, the perspiration are probably the main two. For me, I have diarrhea more than most people, and I've read that can be a side effect. Those depressants affect your digestive system, so that might be a side effect. It's not all the time, but it's probably more than a normal person, and so I have to deal with some of the consequences of that. All right, the last side effect is the most debilitating and dangerous for me, and so I saved it to the end. And I think it's probably very unique to me. So a lot of people aren't going to have this particular problem, but all antidepressants in this class that I am taking make you extremely vulnerable to heat exhaustion and or heat stroke. And it basically is because it affects your body's ability to shed heat, to sweat and shed heat like it normally would. And unfortunately for me, because I'm a land surveyor living and working in Central California for about 5 months out of the year, I'm at least a couple days a week trying to work at temperatures over 100 degrees. Now, when I'm down in the valley, it doesn't seem to impact me. But if I get above 4,000 feet up in the foothills or the Sierra Nevada, where we do a lot of our work, it is a major problem for me. So I'm getting better at managing it and identifying the onset of the heat exhaustion. And it's a combination, I think, of like heat exhaustion and altitude sickness, but it has a huge impact on my ability to work in the mountains in the summer times. And it's dangerous. So just so you guys know, what happens is I'm working, carrying 50 pounds or 80 pounds of survey gear around the mountains. It's hot. And my body goes from feeling okay, feeling normal to, in the space of about 3 minutes, I'm laying on the ground, extremely dizzy, feel like I want to vomit, cold sweats, heart rate, accelerated heart rate, feel like I'm going to die. Like, it is the worst feeling I've ever experienced as a human being. And that can last anywhere from 10 minutes to 45 minutes, just laying on the ground, absolutely miserable. Usually I manage to crawl myself into some shade. I think if I was in a position where I couldn't get myself to shade and cool down, I could get really serious, like life threat, potentially that kind of heat exhaustion. Yeah, that's a bummer. So I notice I'm more prone to it at elevation. It's way more of a problem when it's hot. I will let you know, though, that happens to me above 4,000 or 5,000 feet, even a relatively cool temperature. If it's above 75 degrees, it becomes a problem if I'm at elevation and I have to keep an eye on it. And that's 9 months out of the year here. It's above 75 degrees at 4,000 feet. So I have to really watch it. Now, I've learned to manage that. My partner, Brian, has helped with a little bit with that, and I've done some reading and research on it. Look, I can't drink a lot of caffeine on those days when I know I'm going to be up in the woods. I drink a lot of electrolyte water. I have to carry cold water with me. I carry frozen neck bands with me. Like, I got to very proactively work to keep myself cool. And I've also learned when I start to feel dizzy, I can start to feel the onset of it. What gets me into trouble is when I start to feel that way and I push too hard, and then I push myself past the tipping point, and it's a pretty steep tipping point. So what I've learned to do is, as soon as I start to feel those symptoms, I just immediately stop, find a shady spot, and try and cool down or rest. And that allows me to manage it. I've gotten better at managing it. Man, I still had 3 or 4 incidents of pretty bad heat exhaustion, altitude sickness last summer, which is too many. I'd like to get that down to one. One incident a year is probably still too many, but I think it's achievable. That's reasonable. So yeah, this has had a major impact on my ability to work. Make a long story short, I don't get to work by myself anymore in the mountains. And I shouldn't be anyways. I shouldn't be working by myself. But I used to work by myself in the mountains, and I used to hike by myself in the mountains, and I can't do that anymore. I can't do it. It is super dangerous for me. I'm just not allowed to do it anymore. My partner and my wife won't allow me to do it anymore, and I shouldn't do it. So that's been a big impact on me. Again, if you got a desk job, probably not something you have to worry about. But if you're like me, you work outdoors in the summer when it's hot, that's a known issue with this class of antidepressants, what they call the serotonin inhibitors. Okay, so those are the short-term side effects. What are the long-term side effects? The answer to that question is we don't know. There's been a few studies, but we really don't know. It hasn't been well studied. That question has not been well studied, and some of the newer drugs just haven't been around long enough. There is some evidence that there can be negative effects from long-term use of antidepressants. So, for example, I'm on Paxil. There is one study that shows a correlation, not a causation, but a correlation between long-term use of Paxil and a higher risk of dementia or Alzheimer's. So yeah, that's scary. Now, in my particular case, my family does not have a history of dementia, and I am very healthy otherwise, both physically and mentally. That's not as scary to me as it is as it might be to some other people. That's a risk I think I'm willing to take. Yeah, if I had a family history of dementia, I'd probably be way more worried about that. So we don't have good answers here. What I would tell you is do your research and know your family history and talk to your doctor, because long-term use can have an impact. I'm not talking about you need to get on an antidepressant for a year. I'm talking about if you're a person like me that's been taking antidepressants for 15 years, I will probably take an antidepressant until I die. So yeah, long-term impacts are something that I have to think about. All right, that's all the bad stuff. What's the good stuff? Did you guys have heard me? I've talked about this in one of the other recordings. Yeah, huge benefits for me. I can't put into words how helpful this medication is. Makes a huge difference. Just the way I described it in one of my other articles is it just turns down the intensity dial on emotions. So all of my emotions when I'm not on an antidepressant are way more intense or amplified, the good ones and the bad ones. Unfortunately, as a person with depression, I have way more bad emotions than I have good emotions. So when you dial down the emotions, that tends to be a big net positive for somebody like. But I will tell you, and I think my wife would agree, like it just makes me less emotional. I'm not exactly a robot, but I am less emotional. She notices that. I'm not going to say that hasn't had some impact on our marriage. It probably has had a little bit of an impact, probably less of an impact than me being suicidally depressed, but I have to work to remember to be affectionate and to be happy because my wife is a happy person. I think my antidepressant kind of turns down the dial on all my emotions a little bit. So I have to work to make sure that my wife's emotional needs are being met. That's something I have. But huge net positive. I do not deal with suicidal depression now like I used to. Very rare. That went from me being suicidally depressed 2 or 3 or 4 days at a time, twice a month, to basically zero, guys. It's basically zero. I don't know, maybe once a year, I might have a really bad few day bout of depression. Pretty uncommon. Just pretty uncommon now. Don't forget all the stuff that I talked about at the beginning. Your body's unique. I think we overprescribe. There's bad incentives in the healthcare system. Doctors can be overconfident and arrogant. Okay, but having said all that, I'm talking about the side effects. Like antidepressants make a huge difference in the quality of my life, period, full stop. Along with diet and exercise and getting enough sunlight, taking a small dose of Paxil every day eliminates a huge amount of my suffering as a human being. It does. I really believe that. Now, some of that could be placebo effect. I'm not denying that. I don't know that I care. I don't know if taking that pill every day makes me feel that much better and it's just placebo effect. I don't care. I'll take the placebo effect. It makes a difference for me. And it might make a huge difference for you. Here's a big caveat, if you suffer from long-term severe depression. I really encourage you, if your depression you think might be short-term or it's not severe, to consider diet, exercise, therapy, counseling, sunlight, before you get on an antidepressant. But if you are suicidally depressed, you can't hold down a job or get out of your house. Take the antidepressant. Take it. Take it. I don't know what else to say. Don't suffer unnecessarily. So it has made a huge difference in my life. All right, now I'm going to close with this. Having said that, I wish I could get off of it. And it's not even really because of the side effects, although it irritates me not being able to work in the mountains when it's hot. But given the huge benefit I get and the relatively minor side effects, this is a triumph of modern medicine, right? Like, why do I want to get off my antidepressant? If I could push a button right now and get off my antidepressant, I would. Why? I don't know that I have an answer to that. It makes me feel weak. It makes me feel like I'm not a real man. It makes me feel defective or flawed or broken. I do not like it. I wish I could be strong enough to not need it. And I know even as I tell you that, I know it's not logical and it doesn't make sense. It's how I feel. Probably if it were not for my wife, I would not be on it. I would not be on my antidepressant and I would suffer. I would just suffer. Now, why does my wife want me to take my antidepressant? I think she worries about what might happen if I'm not taking it. Some of that worry is probably valid. And she doesn't like to see me suffer. Yeah, I'm okay with the suffering. Like the pride in me would be like, I'd rather just suffer a couple times a month with suicidal depression than have to take the stinking antidepressant. But my wife is making a much more reasonable analysis of that trade-off there. And she's like, yeah, no, I don't think so. Like, I'm not going to let you have a gun barrel in your mouth once a month just because you don't want to take a stinking antidepressant, knucklehead. So yeah, she makes me take it, and I take it for her because I love her. And if I didn't have her, I probably wouldn't take it. And I say that knowing that is probably the wrong answer. So this gets back to what we talked about on the last episode, the last recording I did. This is why young men with depression need an advocate. They need somebody that loves them to say, hey, you should really think about taking this antidepressant or staying on your antidepressant. I talk to my wife probably once a year about getting off my antidepressant. She's like, no way, Jose. She don't even have to think about it. She's like, no, you're not getting off your antidepressant. Like, you need this medicine. Now, look, she sees me in a way that I cannot see myself. And she sees me when I get a little bit depressed. She sees me when I have flashbacks of child abuse. She sees me in a way that I cannot see myself. And so I have to trust her. I have to trust her. When she says, I know you don't want to take this medication, but I don't think you should get off of it. I have to trust her. To some extent, I cannot trust my own judgment in this one area of my life. And even admitting that is humiliating. But I, Landon Blake, probably am not in the right position to decide if I, Landon Blake, should stay on my antidepressant. I probably need to outsource that decision. And it may be the only area in my life where I feel that I am not competent at probably making decisions for myself. And so because I love and trust my wife, I basically let her make that decision for me. So I hope you have somebody in your life that you can do that with, if you're thinking about this. Now, I'll close with this. Now that I've told you how I feel. So that's how I feel. I feel like I don't want to take my antidepressant. I think it's pretty common. Okay, that's how I feel. Now, here's what the logical part of my brain is going to tell you, now that I've told you how I feel. Why on God's green earth would I get off my antidepressant when the side effects are super minor and there is such a huge benefit to me? Why would I go back to all of that suffering? Doesn't make any sense. And for me, there is a huge downside risk to getting off the antidepressants. And that is that I might commit suicide because my depression is suicidal. Like, why risk the one time I actually pull the trigger on that gun or slide that knife across my wrists? Why risk that? Like, I am not stupid. I understand that ending my own life would have a huge, devastating impact on my circle of family and friends. I would hurt so many people if I did that. I would hurt so many people. I would hurt so many people. I would hurt so many people if I took my own life. And I know that. And that means for me, now this might not be true for you, but for me, because I know that risk of suicide is so real, for me, that means I can't roll the dice with getting off the antidepressant. Because I think I could. I'll be honest with you. I think I could. I think I could get off. I think I could exercise enough and watch my diet and get enough sunlight and maybe do a little more therapy. I think I could get off that antidepressant and be okay. But there is a 5% chance that if I wasn't on the antidepressant, I would have a really bad episode of depression. And I would seriously consider suicide to end that pain. I don't know, 5%, folks. Or maybe it's not even 5%. Maybe it's 2.5%. So 1 out of 40. I don't know. So if I get severely depressed 4 times a year and I got a 1 out of 40 chance of potentially taking steps to end my own life, yeah, that means once every 10 years, I'm going to get pretty close. And some people are probably listening to this and they're probably laughing in the back of their minds because I'm treating this problem like I'm a land surveyor, right? Like I'm applying probability and statistics, but those are the numbers, I think. There's a 2.5% chance that if I wasn't on my antidepressant in any given year, I might take my own life. And for me, 2.5% is too high. I can't take that risk. I can't take that risk. I got people that I'm taking care of. I have employees. I have a business partner. I have a foster son with autism. I have a wife with a major neurological disorder. I have people count on me and I can't risk it. So you know what? I just have to deal with the side effects. I have to manage the heat exhaustion. And I have to swallow my pride. Bottom line, for me, staying on the medication or getting off of it is all about my pride. Period. Full stop. It's all about my pride. And I can't allow my pride to risk the damage to my friends and family if I committed suicide. I just can't do it. This is not worth it. I didn't understand that at 25, but I do at 45. So for me, I got to stay on the medication. And I probably will. I'll stay on it. As long as my wife is alive and we're married, I'll stay on those meds. Everybody's different. I guess I'll wrap up by saying this. We over-prescribe antidepressants in America, I think. That's pretty obvious from the research. But if you have severe depression and you're not on antidepressants, you probably need to be. If you're thinking about taking your own life 3 or 4 or 5 or 6 times a year or more, you need to be on an antidepressant almost certainly. So don't fool yourself. And you got to some extent, you might need to do what I've done, which is I have outsourced that decision to someone that loves me. You might need to do that. And it's hard to let go of that control. It really is. But that might be the one part of your life where you have to give up control to someone that loves you and that you trust because you are not in a position to evaluate your own mental health. So I hope you have somebody like my wife in your life that you can do that with, because you probably can't trust your own judgment. Now, that doesn't mean you shouldn't do your research and you should educate yourself and that you shouldn't talk to a doctor and get an opinion from a second doctor and talk to a counselor. You should do all of that stuff with that person that you love involved in the process. And then you make that decision with them. Okay, one last thing, one closing note. If you do decide to get off your antidepressant, and I think about it sometimes, a lot, I think about it a lot, get off my antidepressant. You cannot stop cold turkey, which is the way I would want to do it because, I don't know, because that's the way I am. Don't stop cold turkey. You got to taper off those drugs. The research is pretty clear that you need to taper off those drugs. If you stop cold turkey, you can immediately have a deep depressive event, which is dangerous. Taper off. And like, how long is taper? Like, it's not 2 weeks from what I've read. Like, that is several months. You got to taper that drug down over several months. And you really need to be doing that while you're talking to a doctor and maybe a counselor or a therapist, potentially. So don't just stop, which is another reason to not get on them unless you really need them. So if you have mild depression, try and do it with diet and exercise and other alternative forms of treatment, therapy, and getting enough sunlight, being outside before you get on them. Because once you're on them for a long time, you don't just get off of them. It's not just like flipping a light switch. If I wanted to get off Paxil now, I would probably have to taper that over 6 months and maybe do some counseling while I went through that process. So something to think about. Okay, that was longer than I thought. I thought, how long can I possibly talk about antidepressants? Yeah, I did 45 minutes. So I hope this helps some people. I hope it does. Hope it helps some folks. So I'll get this up. I'll get this on the web, and I'll get the article processed here probably today. In the next couple of days, we'll get this processed and I'll get it up on my website.